I'm bringing greetings and acknowledgement on behalf of the Executive Leadership Team and the St. Joseph's Hamilton Joint Board of Governors. Today we're here to congratulate and recognize you as an individual within your health professional practice, as a member within your discipline and interprofessional teams. I would like to thank you for your commitment to clinical services, education, and research. You bring expertise and passion to your roles within your profession and also to the many interprofessional activities that you undertake. Health professional practice at St. Joe's Healthcare Hamilton has been a cornerstone throughout the years since the time our organization was founded by the Sisters of St. Joseph's. St. Joseph's Healthcare Hamilton is an anchor institution in our community with a very positive reputation amongst our patients, families, community, colleagues, and academic partners. In 2020, the contributions of professional practice were shaped by a global pandemic. This year, our professional practice disciplines showed more than ever their extraordinary ability to be responsive, nimble, and collaborative, with these disciplines driving and adapting clinical practices, research, and adapting practices to support learners. We're very grateful for your leadership, readiness to drive positive change, and investment in ensuring that St. Joseph's Healthcare Hamilton is committed to excellence and dedicated to discovery.
As always, the annual Professional Advisory Committee report shines a spotlight on 19 health professional discipline groups here at St. Joseph's Healthcare Hamilton. The contributions of the professional disciplines in healthcare is extraordinary at all times. In 2020, the contributions of professional practice were shaped by the global pandemic. This year, professional practice disciplines showed more than ever their extraordinary ability to be responsive, nimble, and collaborative, with these disciplines driving and adapting clinical practices, research, and changing our practices to better support our learners. On behalf of our board and the senior leadership team, we are very grateful for your leadership, your readiness to drive positive change, and your investment to ensure that St. Joe's Healthcare Hamilton is committed to excellence, dedicated to discovery. Thank you.
Thank you so much for joining us for the PAC Excellence in Practice Awards ceremony. I'm Monica Alderson. I am one of the vice chairs for the PAC. Our PAC always wants these awards to be bigger than just the awards. We want to celebrate and show gratitude for the work of all the disciplines in the PAC and to shine a light on areas of excellence from individuals and teams. But this year especially, the PAC really wanted to underscore, celebrate, and show gratitude for the incredible work done by each discipline and every single person in that discipline during this pandemic. So our usual awards will include sections highlighting these achievements and show our admiration and gratitude for them for each discipline. I am so privileged to be able to bring these awards together. It means that I get to read the stories and learn about work that's being done at St. Joe's and achievements that maybe I wasn't aware of, or maybe I just didn't understand the enormous effort and energy and bravery it took to achieve them. For the nominees, every single one of you is really a winner today. Someone or someones took the time to complete a nomination for you, to share your work and your achievements, and that speaks volumes. Thank you so much for the incredible work that you are doing here at St. Joe's. You will receive a certificate of this nomination because being nominated is significant. And now we begin.
The world changed dramatically in 2020. As the pandemic continued, addiction workers responded to a significant increase in people seeking support due to substance use and declining mental health. For marginalized clients, many of the programs they depended on closed, leaving people feeling alone. Some of the ways addiction workers responded at St. Joe's to the emerging needs were by the capacity building team continuing to provide in-person care across the hospital throughout the pandemic. Both Womankind and MASH restructured their physical environment so they could remain open, despite many other addiction services in Ontario closing. Through partnerships with Good Shepherd, Mission Services, the YWCA, addiction workers are on site at Notre Dame Youth Shelter, Carol Ann's Place, and the Admiral Hotel, providing expertise which allows clients presenting with active substance use to be supported. Womankind engaged in a pilot with Good Shepherd to provide on-site support at Mary's Place. Addiction supports to the emergency department were increased as a result of the increased demand, and addiction workers responded to increased requests for naloxone training due to an increase in the number of overdoses.
Over the past year, the audiologists adapted remarkably to the changes associated with the pandemic. As a primary outpatient service, they initially experienced a temporary shutdown of in-person services, then redeployment as screeners, followed by reinitiating of the audiology service. During the restriction of inpatient services, the audiologists offered curbside and virtual appointments. They also explored alternative ways to communicate with hearing impaired patients secondary to the impact of masks. These included the use of the Dragon dictation system and investigation of clear masks. Once in-person services resumed, audiology successfully maintained their service despite the challenges of physical distancing and cleaning between patients. I would personally like to thank the audiologists for their commitment to their patients, profession, and the audiology service this past year. Their service has also been recognized by the community as the recipients of the 2020 Hamilton Spectator Gold Award for Audiology Services.
Highlights for clinical nutrition include being adaptable as they quickly and seamlessly pivoted from in-person to virtual care to support many ambulatory programs. As hospital operations were ever-changing, they demonstrated teamwork and resilience with frequent adjustments to areas of coverage, changes to referral volumes resulting from bed surge, and ramping up and ramping down. They also supported and facilitated cross-training so that they could proactively be prepared for a surge in COVID patients in the critical care or acute programs. And because they were proactive, they were well prepared for the third wave of the pandemic. They also continued to collaborate with food services and advocate for the nutritional needs of their patients.
The Individual Clinical Practice Award of Excellence. This award honors a health professional who focuses on providing the highest quality of service in his or her area of practice, demonstrates a partnership with his or her patients and or families by mutually establishing a plan of care, and whose practice is informed by current best practice evidence. And the nominees are Maria Annette Bronze, described as level-headed, calm, helpful, and a consistent bright light. She consistently seeks to increase her knowledge base and improve her technical skills. Sam Crooks. Sam is incredibly knowledgeable with regards to forensics and is up to date on all important forensic information to inform staff and patients. Robert Frazier. Robert has not only been a support, advocate, and essential part of the team for patients at St. Joe's, but is often a central source of support and connection for nephrology patients and teams provincially and nationally. Loretta Gundick. The work Loretta does can be best measured by observing the smiles on the faces of those she works with, the obvious connection she makes with everyone she encounters, and the lasting impact of belongingness that can be felt on her unit as a result of her presence. Erin Harvey. Erin's flexibility allowed the OT department to navigate staffing shortages, and her creativity enhanced the satellite health facility with a multi-sensory and a guided sensory mindfulness group to reduce responsive behaviors. Cassandra Jolliffe. She is a well-respected member of the Diagnostic Services team and a reliable source and always willing to offer an honest opinion when considering departmental changes. Devin McDonald. Devin has risen to the COVID challenge in the vaccine clinic by taking time to talk and educating and supporting our seniors. Gail Pinelli. Gail is the kind of nurse that takes the time to ensure patients get a good wash or a proper shave. She began to impact the nurses' behavior around her by role modeling positivity and compassion in a very difficult time to show these characteristics. Alexandria Ali Ritchie. Working in the medical bariatric program, Ali facilitated a process with pharmacy to have prescription meal replacements available for curbside pickup and delivery. She was also redeployed to the vaccine clinic. Carol Sweeney, going above and beyond the call of duty in order to improve a patient's transition to the satellite health facility and then to long-term care facilities. Suzanne White, during the lockdown, she supported her patients by shopping for them and creating packages of activities to alleviate boredom and supported wayfinding to the vaccine clinic. She is retiring in 2022, and this hole she will leave cannot be filled. The winner of the Individual Clinical Practice Award of Excellence is Carol Sweeney from Social Work. We will now ask Jamina Siliker, Manager and Professional Practice Leader for Social Work, to present the award.
It is my honor and privilege to present this award to Carol. Carol has been at St. Joe's for over 25 years. Among her many assets, which include her strong clinical skills, courageous advocacy, caring, person-centered interventions, master of crucial conversations, and a strong sense of social justice, Carol also consistently goes above and beyond for her patients, which often would see her out in the community buying items needed by patients after working hours. Carol is an incredible mentor, inclusive, approachable, and integral team member. No matter where her social work assignments sit, and she's had many, she's been an incredible person to work with. Most importantly, Carol carries and lives the St. Joe's mission, as well as our social work ethic and values. I am grateful to Carol and deeply appreciate and respect her. Congratulations, Carol.
Thank you so much. It's an honor, especially to get it from you.
Thank you, Carol.
Thank you.
The Diagnostic Services team is made up of many allied healthcare professionals. The COVID-19 pandemic presented numerous challenges for our staff. Our teams answered the call to action. Their unwavering commitment to quality patient care and teamwork is an essential component of the organization's COVID-19 response. Our frontline heroes are instrumental in providing imaging services to support the diagnosis, treatment, and recovery of COVID-19 patients. Despite the hardship and pressures encountered this year, Diagnostic Services continued to find innovative ways to support the needs of the community, improve access to care and new technologies, and celebrate significant life events with our patients and families. Thank you for your courage, dedication, and perseverance. We are stronger together.
The dialysis technology professional practice had to respond to the pandemic knowing that 20% of critically ill COVID-positive patients will go on to develop acute kidney injury requiring dialysis. So where the organization had to flex into non-traditional patient care areas to accommodate this potential surge, we had to ensure that these areas were also capable of accommodating dialysis therapies, which require specific electrical service and water access. Further to this, we also had to ensure that we had equipment enough to handle the surge while still providing dialysis to our over 600 chronic hemodialysis patients across our 4 sites. Heading into Wave 3, emphasis was placed on staffing and contingency models. In dialysis, where nurses were redeployed to critical care areas, our surge plan involved expanding our nurse-tech collaborative model of care. Normally, we operate with 3 collaborative pods across 2 sites. Our surge plan, in the worst-case scenario, flexed up to 7 of these collaborative pods over all 4 sites. 4 additional collaborative pods would enable 8 nurses to be reassigned to higher demand areas if required.
Medical Laboratory Technology. Although we are a regional lab program, the Charlton site is home to the virology lab, where they have been performing all of the COVID testing. In March of 2020, we developed and implemented an in-house COVID-19 PCR test, and in a matter of weeks to months, the laboratory went from testing a few samples to a few hundred to a few thousand each day. We now have the capacity to perform more than 8,000 COVID tests per day. In order to be able to accommodate the increased workload, we implemented robotic liquid handlers. We tripled the number of staff working in the virology laboratory, both MLAs and MLTs, and we implemented 24/7 shift coverage for COVID testing. To date, the virology laboratory has performed more than 600,000 COVID tests. And while all of that COVID testing was going on, our HRLMP laboratories continued to perform up to 30,000 other laboratory tests per day. This has been quite a year for the laboratory.
Individual Teaching Excellence in Practice Award. This award goes to a preceptor or mentor who furthers professional practice of his or her discipline and contributes to the professional growth of students and colleagues. This preceptor engages in partnerships with learners who strives to maximize learning opportunities by identifying appropriate learning resources and providing specific learning opportunities and role models excellence in professional practice. This preceptor is a truly reflective person who seeks and is receptive to feedback regarding his or her performance. And the winner is Joanne DeJager, Nursing. I would like to ask Anne Belikowski, Senior Manager for Infection Control, to present this award to Joanne.
All right. Well, it gives me great pleasure to present this award to Joanne for individual teaching on behalf of the Professional Advisory Committee. Joanne came back to us from retirement to assist in the Congregate setting with all the work with COVID-19, and it has been a tremendous amount of work, and she has done amazing work, and we're so grateful for all of the work that she's done. It's an incredible list. I'm not going to go through all of it, but I am going to give you some of the highlights for sure. She's done 50 on-site assessments and audits with the Congregate settings with public health, and done teaching as she's done those assessments. She's provided education to more than 300 staff at various sites. She's completed train-the-trainer sessions for long-term care, retirement home, and other Congregate settings. And she's collaborated with the nurse educator to create a training video on donning and doffing. Without her work in the Congregate settings, we would not have achieved the success we have at assisting the long-term care facilities and the retirement homes to move the needle and to come out of outbreaks in some settings. And so for that, I'm forever grateful. Joanne is continuing to do that work for us, and I know that she has gotten some very positive comments from the retirement homes and the long-term care facilities, so I'm looking forward to that ongoing work. So on behalf of the Professional Advisory Committee, I would like to present this award to you, Joanne. It is very richly deserved.
Thanks, Anne. That's wonderful. You know, I'm really humbled and honored to receive the Excellence in Teaching Award this year. Let me start by saying that I had worked on the incredible IPAC team at St. Joe's from 2009, and I actually retired in 2018. But one morning in March 2020, Anne called and asked me if I'd consider returning to St. Joe's to support the IPAC team due to the potential pressures of COVID-19. I wasn't quite sure what would be expected of me or what my responsibilities would be. However, I was soon assigned as IPAC support for the Satellite Health Facility and the Congregate Settings COVID-19 Crisis Response Team. At the time, I had no idea what amazing people I would be privileged to work alongside. People who really embody the true spirit of St. Joe's through their work every day, that of dignity, respect, faith, and service. There's lots of examples I could share, but one really made a lasting impression. It was on a cold morning, mid-December 2020, that St. Joe's staff in large numbers answered the call to support a long-term care facility that was in difficulty. I saw firsthand how St. Joe's employees worked together day after day to provide leadership, compassionate care, and hope to the residents and staff. This is what it means to be part of the St. Joe's family, living the legacy. As part of the Congregate Settings team, I had the opportunity, as Anne mentioned, to be in so many unique situations in over 50 long-term care, retirement homes, and residential care facilities, and providing education to all of these staff. And really the desired outcome was to raise the IPAC bar, curb that spread of COVID-19, and provide staff with best practice and sound IPAC knowledge. All of these accomplishments were due to the dedicated support and work of the team. I'd really just briefly like to acknowledge some people who have supported my work over the past year and made this award possible. To the many staff I collaborated with in congregate settings, and that includes public health, I say thank you for your compassion, dedication, hard work, and willingness to embrace new ideas. To Jane Lonke, her unwavering leadership, wisdom, and dedication to the congregate settings team was invaluable and so respected. To Amanda Weatherston, her vision, leadership, and let's get it done attitude was just what was needed. We became known as the team in the community with our matching Eddie Bauer vests. And to Anne Belikowski. Anne, if you know her, she lives and breathes IPAC. She's nationally respected for her incredible wealth of IPAC experience and knowledge. And really, I had the privilege of knowing that she was just a phone call away. Others who are part of the team and always ready and willing to provide their expertise were David Keene, Manager of Environmental Services, Helen Harris, Manager of Mental Health, Catherine Duffin, Nurse Manager. I just want to end this by saying my sincere thanks for the recognition of this award. Thank you.
Hi, I'm Larissa Wollman, Director of Nursing for the Mental Health and Addiction Program and Professional Practice Lead for Nursing and Mental Health. I'm so very pleased to have this opportunity to talk about contributions of nursing over the past year. And there are so many to list, so here's just a few. Nursing implemented customized 3-inch buttons for staff and physicians that show the staff's face behind the mask as a way to enhance the connection between care provider and patient and family member. Nurses provided a daily call to families with clinical and emotional updates regarding their loved ones' care. Across the inpatient and outpatient mental health and addiction program, nursing has continued providing expertise, leadership, and contribution to a multifaceted interdisciplinary suicide prevention strategy. Throughout the year, nurses across St. Joe's were all supported to work to their full scope of practice. This work was especially evident during the pandemic when medical directives and other strategies were implemented to optimize nursing scope of practice and expedite care to patients in need. Nurses demonstrated significant leadership, expertise, and compassion in assessment centers, vaccination clinics, congregate settings, providing exemplary clinical care every day, and also supporting our learners during these unprecedented times.
Like everyone, occupational therapists and assistants modified their practice during COVID-19 to continue to support others. Helping our healthcare community. Our OTs worked with McMaster School of Rehabilitation Science to develop guidelines for rehabilitation professionals for COVID-19 early in the pandemic. Helping our inpatients, teams, and communities. Many OTs shifted to support other disciplines. Some took over nursing work during nursing shortages. With no groups, families, or volunteers, recreation could not keep up with the needs at Charlton. The rehab assistants put together activity kits for use with patients during this isolating time. 2 OTs were redeployed to work in long-term health care facilities in outbreak, providing basic care to residents, as well as hand hygiene audits, PPE, and infection control education. Helping our outpatients and families. Many OTs modified practice to provide virtual assessment and treatment, including many mental health services, including groups such as CBT at East Region and the Respiratory Rehab Group Education. OTs provided education to outpatient mental health clients on how to use tools for virtual care and how to connect and use online resources available within the community. Helping our learners. OTs and OTAs offered twice our usual placement opportunities to students to ensure they graduated.
Individual Leadership Excellence in Practice Award. A health professional who promotes excellence in his/her profession by demonstrating innovative leadership which advances an environment conducive to quality patient care, professional practice, decision-making, fostering educational opportunities for staff development, producing research, applying evidence to practice, and excellent precepting mentoring of learners. And our nominees. Kate Aben from Occupational Therapy. As a frontline OT, Kate models a way forward, engaging patients to color pictures about recreation during TR month, or write thank you cards to the unit social workers during Social Work Week. She advances everyone. Whether representing on numerous unit and corporate committees, taking on outpatient work as well as her usual work during staff redeployment, or effectively mentoring students, she is a strong information leader in forensics. Dina Burnett from Nursing. Dina stepped up in numerous ways during the pandemic, from managing the screening stations, overnight managers on call, and taking on the interim director role of surgical services. She has led by example, as well as furthering her education while working full-time and somehow doing an exemplary job at everything. Susie Maroney from Therapeutic Recreation. Susie led her therapeutic recreation team to transform their care, shifting to individual support to patients, providing recreation activities and tools for patients, including the COVID unit. She ensured that infection control guidelines were met throughout, supporting patients connecting with their families through technology and collaborating to develop processes for window visits. Magda McCaukin from Physiotherapy. Being a mom herself, Magda understands the importance of work-life balance, being creative to come up with solutions to support her staff with different childcare issues, school closures, and isolations. She modified her work schedule to support her staff and ensured they had access to mental health supports, vaccinations, and information. Carmen Newstratton from Pharmacy. Carmen is an example to us all. Carmen, during a pandemic, led her team to provide pharmacy 24/7. She's leading the COVID vaccination rollout and implementing a new state-of-the-art pharmacy robot. Mary Stock from Nursing. Throughout her 30 years of work at St. Joe's, Mary's dedication, commitment to staff and patients, her vibrant and energetic personality, along with tremendous leadership in being an ambassador on the unit for many initiatives, have made her the glue that holds the nephrology program together. Carrie Whitelaw from Addiction Services. Carrie supported staff and clients across multiple sites through protocol changes, uncertainty, supply shortages, and added stress. She is attentive to the needs of all, flexible, organized, and present. Carrie has truly exemplified what a healthcare hero is. And the winner of the Individual Leadership Award is Carmen Newstratton from Pharmacy. Now we will ask Rick Baziak, Vice President Clinical Programs, to present the award.
A very big congratulations, Carmine, on this remarkable achievement. I'm so happy to know that you have been awarded the Leadership Award. I was thrilled at receiving the news that you won it, and it came as no surprise to me that you won it. This is a ringing endorsement of the exceptional work that you do day in and day out. You're one of those people that takes a challenge and turns it into an opportunity. For you, each challenge is an opportunity to succeed. I've had much opportunity to work with you over the past year in the vaccination centers, and I've seen firsthand your leadership in action. And in an environment where the direction is changing sometimes daily, you have always found a way to ensure that the staff that you work with in this rapidly changing environment have the information and tools available to be able to provide a safe work environment and be able to deliver the best care, safest care for patients. You are always looking forward and advocating for the next group of patients, or correct or make it better for a staff member. You should be incredibly proud of this achievement and accomplishment. Please accept this award in sincere appreciation for your continuous hard work and dedication to the purpose and mission at St. Joe's. I had to make sure I wrote it down so I didn't forget anything. So Carmen, please accept this award.
Thanks very much, Rick. It's a real honor to receive this award, and I'm truly grateful and thankful for all of the team members that I work with day in and day out here at St. Joe's. Thank you.
Hey everyone, I'm Fiona Wilson, Professional Practice Lead for Peer Support at St. Joe's. I'm so pleased to have this opportunity to recognize the work of individuals who are in a peer support role at St. Joe's, working in a variety of settings, including inpatient and outpatient, assertive community treatment, and early intervention with people across the lifespan. Individuals in peer roles are valuable members of the St. Joe's Therapeutics Allied Healthcare team. During the last 18 months, these staff have continued to provide empathetic and compassionate support, both face-to-face and virtually, some doing a hybrid of both. COVID has not limited the collaborative efforts with other disciplines. One example of this is the very successful art mural project done in collaboration with the art therapist in the Mood Disorders program. This is one example of many of the innovative ways peer support staff have continued to reach out, connect, and ensure access to one-to-one and group support to as many people as possible. The use of technology and social media are being used in new ways to engage with and motivate people in their recovery. While we continue to be flexible in the ever-changing mental health care environment, the exciting work of peer support continues and is something we can all be proud of.
Congratulations to the pharmacy team. This award is well deserved. During the unprecedented challenges over the past year, all members of the pharmacy team stepped up to provide comprehensive medication management and, of course, safe and effective medication distribution. For example, clinical pharmacists provided medication assessments and recommendations to all the new admissions. The pharmacy team also supported COVID research, assessed new COVID therapies, and were leaders of strategies to reduce drug shortages during the pandemic. Pharmacy technicians also stepped up with additional responsibilities, 24 hours a day. Thank you. Other major achievements in pharmacy this year also included 1, the launch of 24 hours a day, 7 days a week for pharmacy hours and overnight staffing. And 2, last but not least, the fact that pharmacy stepped up to launch and staff the large-scale vaccine clinic at West 5th for the residents of Hamilton. So today we celebrate everyone on the pharmacy team. Thank you for your contributions and for the important role you play day in and day out.
The Individual Innovation in Professional Practice Award. The health professional demonstrates an ability to develop innovative and adapted practices for clinical service delivery, introduce and enable new approaches to enhance the quality of patient care and professional practice. The health professional is progressive, favoring or promoting progress in their profession and clinical service. Individual Innovation in Professional Practice Award nominees: Rayanne Banaga, Peer Support. She has proven to be a champion in engaging and supporting Black and racialized young people through her creative and innovative practice. Camilla Gemin, nominated twice for this award. Camilla was able to adapt her group online to offer virtual yoga, growing gratitude, and art journaling, starting these groups at the Bridge to Recovery and expanding them to the community psychiatry clinic. Taylor Hatchard. Dr. Hatchard led the development of transformations and innovative program that aimed to improve mental health in transgender and gender nonconforming youth. Nancy Cowell facilitated Smart Start, a fitness program for those physically deconditioned and extra support due to cognitive barriers. Positive Strides, an animal-assisted intervention, and Drum, a unique program that combines drumming with an exercise ball, physical exercise, and meditation. And the winner of the Individual Innovation in Professional Practice Award is Dr. Taylor Hatchard, Psychology.
Dr. Joe Pelzari here, Professional Practice Lead for Psychology. It is my great pleasure to present this Innovation Award to Dr. Taylor Hatchard. In his short time with us at St. Joe's, he's made a significant impact on clinical care delivery for transition-aged youth, TAY, through the Youth Wellness Clinic. Some highlights from the nomination include his leadership in the development of Transformations, an innovative program that aims to improve mental health in transgender and gender non-conforming youth by providing early intervention and low barrier supports. He's introduced electronic outcome monitoring, and he's also led various group therapy initiatives. Dr. Hatchard is an emerging leader here at St. Joe's, truly a rising star, clinical, education, research, and we are thrilled that he is being honored in this way today. Congratulations, Taylor.
Thank you to the Physiotherapy Group for their ongoing flexibility and innovation. We have accomplished a great many things this past year, including, but not limited to, collaborating on the development of interprofessional group sessions at the Satellite Health Facility, development and implementation of virtual physiotherapy gym program for the Respiratory Rehab Day program, involvement in the initiation of international COVID-19 physiotherapy guidelines and development of our own internal guidelines on the COVID unit and in the ICU, and collaboration with West Fifth managers to share staff between sites, which opened more opportunities. That just skims the surface of what we have accomplished. As challenging as the past year has been, we have highlighted our skills during this pandemic and have found many opportunities that we will continue to explore and develop. Physiotherapy makes you stronger, and our high-quality physiotherapy team has shown what we can do when we work together.
2020 was a challenging time for sleep technology. The COVID pandemic prevented our sleep technologist from monitoring patients for several months. Our team was deployed to areas of need in the hospital. As the saying goes, alone we can do so little, together we can do so much. With the reopening of the lab, the team had to review procedures and practices to deliver the highest quality of care, but also keep both patients and staff safe. I congratulate the team in their endurance and determination over this past year.
Dr. Joe Pellizzari here. I am very proud to present some highlights of psychology's contributions during this pandemic year. There was this quick and innovative pivot to virtual care. Psychology staff were eager adopters. Imagine running group therapy over Zoom. Treatment protocols were converted, best practices were developed and implemented in group and individual treatment and neuropsychological assessment. The second highlight is psychology's involvement in the area of mental health and psychosocial supports for healthcare workers. Our one-to-one support portal, now one of 5 provincial resources for staff supports, our model of in-situ supports on various medical units, responding to requests for in-services on coping and resilience, and our drop-in supports. This was accomplished with amazing collaborations and supports with employee wellness, spiritual care, social work, the nurse educator group, and our managers, to name a few. Psychology has been honored and privileged to bring our best knowledge and competencies to supporting healthcare worker well-being. We are still there for you. Lastly, our incredibly talented psychology group was able to maintain our learner programs, our residency program, our fellowships, our practicum and research placements through quick innovation and embracing virtual platforms. St. Joe's continues to be the premier destination in Canada for learners in psychology.
The Team Clinical Excellence and Practice Award. A team of health professionals who focus on providing the highest quality of service in their area of practice demonstrates a partnership with their patients and family by mutually establishing a plan of care and whose practice is informed by current best evidence. The nominees are clinical nutrition dietitians and dietetic assistants. This team initiated cross-training to prepare for an increase in the critical care occupancy, including TPN, enteral support, and nutritional guidelines for COVID. They also provided on-site support during a retirement home outbreak. General Internal Medicine Physiotherapy Team. The team works collaboratively and seamlessly to support each other in their work so that each physiotherapist can provide compassionate, timely, safe, and patient-centered care for each and every patient. King Hemodialysis Unit and Educators.
With the introduction of central line access, delegation dialysis techs in 2020, patients received care in a truly collaborative pod with access to nursing assessments and the expertise of highly skilled technologists initiating the dialysis procedure and care. MRI team. This team increased their capacity and hours to catch up with the backlog of appointments from the first lockdown with no extra staff, maintaining high quality service. Satellite Health Facility interprofessional team and managers and leads. This team transformed a hotel into a safe place for patients to wait for long-term care. Virology technologists and technicians, assistants and staff working at St. Joseph's Healthcare Hamilton, they are the unseen heroes in the lab that no one really knows about. We have 2 winners in this category. The first award goes to Virology technologists and technicians, assistants and staff working at the Virology lab at St. Joseph's Healthcare Hamilton. I would like to ask Sandra Fazzari, Director, to present this award to team representatives.
The Virology Lab and the COVID team have been exceptional during this entire pandemic. We have completed over 650,000 tests to date. You have been leaders in innovation. We would like to commend you in all your dedication. You all showed a determination like no other to provide our hospital, our city, and our province with exceptional turnaround times for COVID testing. You are leaders in the province. St. Joseph's and HRLMP would like to congratulate you and thank you for all your hard work.
Congratulations. Thank you, Sandra. I'd like to point out that this award has been deeply deserved and deeply earned by all the MLAs and MLTs in the Virology Lab who have worked tirelessly 24/7 to produce the COVID results, and all the support people who have helped us get there with supplies and ordering and paying our bills. So thanks everybody who helped us.
The other winner is Satellite Health Facility interprofessional team and managers and leaders. I would like to ask Dr. David Russell, Interim Vice President, Academic and Medical Affairs, and Chief of Staff, to present this award to representatives of this team.
Good afternoon. It's my pleasure to present the Team Clinical Excellence and Practice Award to Elisa, Brian, and Jamina Seliker. Three stalwart health professionals have been at the alternate health facility, also called the Satellite Health Facility, down on King Street since early January of 2021. This move, I think, represented a spectacular innovation in healthcare. We transformed a hotel into a safe hospital practice environment. People had to face down the fears of COVID, working without vaccinations, working with people who were ill and unsettled in this new environment. This took, I think, incredible courage, incredible teamwork, and incredible professionalism. And I think all of these individuals exemplify all of the qualities inherent in this award. So congratulations.
Thank you very much, Dr. Russell. And on behalf of our extremely dedicated interprofessional team down at the Satellite, I wish to give thanks on all our behalfs.
I am Leslie Brooks, Manager and PP Alpha Respiratory Therapy. I would like to recognize the hard work that the respiratory therapists do for all of our patients requiring ventilatory and cardiovascular support here at St. Joseph's Hospital. During this past year, some examples of what respiratory therapy has provided include to continue to provide optimal respiratory care in the midst of a respiratory pandemic, assistance in the development and education of protected code blue and emergent airway management strategies during the pandemic, assisted with the implementation of new critical care monitors in the clinical critical care surge spaces, participated in working groups regarding best practices for AGMPs, as known as aerosol-generated medical procedures, in various areas of the hospital during the pandemic. Our clinical resource leader has been an integral member, including the respiratory therapists, of the multidisciplinary simulation team in the Emerge department, plus other areas to include protected code blue simulations, critical care simulations, and simulations that occur in the Women's and Infants program.
During the first wave of the pandemic, social work provided significant support and practical assistance to family members who found themselves unable to visit their loved ones once they were admitted to hospital. Social work facilitated visits between family members and patients and connected family members to the care team to support their ongoing inclusion in the care of planning for their loved one. During the third wave, social work increased their service provision from 1 full-time social worker 5 days a week to 4 full-time registered social workers, 12 hours per day, 7 days a week, in order to meet increased demand in critical care. As a member of the Psychological and Health and Safety in the Workplace, social work supported the oversight of developing and implementing an employee peer support program. Social workers supported the evacuation of 2 facilities in emergency situations, a retirement home closed due to a COVID outbreak, and a residential care facility closed due to an emergency order by the City of Hamilton.
The Team Teaching Award of Excellence. This award is given to a team of preceptor mentors who furthers professional practice of his or her discipline and contributes to professional growth of students and colleagues. A team of preceptor mentors who engages in a partnership with learners who strive to maximize learning opportunities by identifying appropriate learning resources and providing specific learning opportunities, and role models excellence in professional practice. A team of truly reflective preceptor mentors who seeks and is receptive to feedback regarding his or her performance. And the winner of the Team Teaching Award of Excellence is the Occupational Therapy Clinical Instructors. I would like to ask Azim Ganji, the Vice President of Education, and Monica Alderson, the Manager and Professional Practice Leader, to present this award to team representatives.
St. Joe's is an academic health sciences center, and teaching is a major priority for our hospital. When the pandemic set in, learner clinical placements were placed on hold. However, we quickly realized that this would delay the graduation of our vitally important future healthcare professionals. An imminent need was then identified, and everyone at St. Joe's stepped up to provide the very important practical and clinical learning opportunities for our learners.
At a time when just getting through the clinical day was enough for most people, OT stepped forward quickly to provide learning opportunities as soon as we were able to do so, overcoming barriers like, I'm not working in my normal job right now. What's this going to look like? How will I do this virtually? Will I be able to provide a quality placement? All of these were problem solved and overcome by the OTs and OTAs, and we were able to offer our typical number of placements. But the community was not able to provide placements at that time. And so Mohawk and McMaster came forward again and again, asking for more opportunities. And our group stepped forward, creatively sharing students, or to maybe even taking their first student, having a placement in a unique situation which we've never done before, or taking 2 students, which isn't typically our practice. And in total, we were able to almost double the number of offerings that we typically provide during this time, pre-COVID. With everything going on, our clinical instructors were even able to provide really excellent learning opportunities for our students based on their feedback. And they kept the human element as well. One of our clinical instructors noted that the first year OT students had never actually met one another because they were learning virtually. So she arranged a socially distanced time for them to meet each other while they were all on placement at West 5th. We've benefited from these graduates because we've been able to hire them at a time when staffing has been really a challenge. So I want to thank the clinical instructors from OT and the OT assistants for taking all these students and really living the mission for teaching at St. Joe's. Congratulations.
Excellent. Congratulations.
Thank you.
During this past year, speech-language pathologists successfully adjusted to many changes related to COVID. They connected with other SLPs regarding the role of SLPs for patients with COVID. They supported their interprofessional team members by assisting with Zoom calls with patients and families and provided aphasia-friendly handouts to help patients understand restrictions due to COVID. The outpatient service provided virtual and telephone appointments. SLP was also part of a clinical advisory group and local investigator for research related to swallowing impairments and patients recovering from COVID.
SLP also successfully participated in a number of head and neck initiatives and supported learners over the past year. Lastly, the SLP service received the 2020 Hamilton Spectator Gold Award for SLP services. A big thank you goes out to all the speech-language pathologists for their dedication to the profession and to St. Joe's over the past year.
Spiritual care providers have gone above and beyond during the pandemic as we've continued to provide one-to-one support to patients throughout our hospital as they sought to make meaning of their health experiences without their usual relational supports or their community faith leaders. We became even more important to people desiring both religious support or a listening ear. We transitioned our spiritual care education program, outpatient support, and the memorial service coming in June to technology. The Greater St. Joseph's Health System Spiritual Care Community of Practice grew together as we shared resources to support our units. We are especially proud that longtime spiritual care provider Feli Toledo received the Mission Legacy Award for her involvement in the Three Wishes Project. We have also initiated with Human Resources Schwartz Rounds, a rounds that focuses on our human emotional responses to our work with patients and families, which will launch on June 24th. Thank you to all of our spiritual care providers who continue to live the legacy of the Sisters of St. Joseph every day.
Team Leadership Excellence in Practice Award. This award goes to a team that promotes excellence in their professions and practice areas by demonstrating innovative leadership which advances an environment conducive to quality patient care, professional practice, decision-making, fostering educational opportunities for staff development, producing research, applying evidence to practice, and excellent precepting and mentoring of learners. And the nominees are Physiotherapy COVID-19 Innovation Team. This team recognized that asking nurses to do more when they went into the room of a COVID patient or trying to talk through things like a baby monitor or a window wasn't sustainable or enough. These physios, armed with early research, collaboration, patient-centeredness, and bravery, stepped in to take on active care of these patients early in the pandemic. Congregate Settings COVID-19 Response Team. This team created collaborations and partnerships with congregate settings to prevent outbreaks and manage them during the many waves of COVID. And the winner is Congregate Settings COVID-19 Response Team. I would like to ask Cheryl Williams, Executive Vice President, to present this award to representatives of this team.
St. Joe's Healthcare Hamilton has a long-standing history of collaboration and partnerships and being responsive to those in need at an individual, a group, or at a community level. The foundation of this work has been created and inspired for us all, driven by the mission of the Sisters of St. Joseph. In March 2020, a call to action was received by St. Joe's Healthcare Hamilton to begin a collaboration with public health, Hamilton Health Sciences, and community partners to support long-term care and retirement homes, and this was later expanded to include residential care facilities as well, as these organizations prepared for and responded to the COVID-19 pandemic. Drawing upon our roots and under the initial executive leadership of Winnie Doyle, and followed next by Donna Johnson, the individuals nominated here today started on this journey to become the collaborators, the teammates, the doers, and the leaders of the St. Joe's Healthcare Hamilton Congregate Settings COVID-19 Crisis Response Team. The impact that the work that these leaders have led throughout the pandemic cannot be understated. It has made such an unbelievable impact to support some of the most vulnerable people in our community sector. And we are so pleased and proud of the work that you have done over this last year and a half, supporting what's been happening in our congregate settings. You brought knowledge, skills, and abilities from your health disciplines, and you also brought your teams of experts to the table to also support the work that is happening. Sometimes this work was very difficult, but always the work was very meaningful, and you always brought everything you had to the table in the most profoundly helpful way. There's very little, I think, that I can say in comparison to actually hearing some of the words and some of the feedback that we received directly from some of the organizations that you supported. Here, comments from one of the homes that you were supporting said, "The team love you here, and we love your team. Not only did you help us turn things around, you also put our burden on your own shoulders, and you helped us carry it when we were completely demoralized and exhausted. There are a lot of us here who will never forget the strength and the kindness that you gave us when we needed it most. To all of our St. Joe's Angels, regardless of your role, you are a gift. You are someone who provides comfort and kindness and have made it possible for our seniors to continue to enjoy a wonderful quality of life. The support that our residents has received from St. Joe's has been nothing less than life-saving." So in conclusion, all I can say is that this team of leaders brought to the table your own commitments and that of your teams to be inspirational and to create groundbreaking partnerships with our community. You led with your hearts, and your daily work is captured by committed to excellence and dedicated to discovery. It is my honor to thank you for all that you've done. And on behalf of the St. Joe's Healthcare Hamilton and the Professional Practice Advisory Committee, I am very honored to provide you with the award for the Congregate Settings COVID-19 Response Team Leadership Excellence in Practice.
Thank you very much. And on behalf of the Congregate Setting COVID-19 Response Team, we thank you very much for all of this and all of your support.
2020 quickly presented itself to be a year of extreme challenge and ongoing crisis in response to the global pandemic. Recreation therapists across the organization rose to task with resilience and innovation. Alongside all of St. Joseph's Healthcare, TR dedicated themselves to supporting the overall cause and continuously pivoted to adapt to ever-changing parameters in order to meet the needs of those we serve. Recreation therapy was an integral part of the development and implementation of window visits to support patients and care providers in order to stay connected during a no-visitor policy. Recreation therapy fostered and developed ongoing community partnerships in order to maintain and increase reintegration for clients as resources shifted through the year. Ambulatory recreation therapy developed and implemented new virtual programs such as yoga, self-compassion, behavioral activation, photo voice, leisure education, journaling, community walking programs, and a number of one-to-one interventions. Inpatient recreation therapy expanded and adapted to include music programs, physical activity, sensory engagement, mindfulness, and creative writing with a focus on small group and individualized care.
I'm Bruno DeFranco, and as practice lead for vocational counseling, I just wanted to express my sincere thanks to all of my colleagues for all of their hard work, dedication, and continued commitment to quality patient care throughout the COVID-19 pandemic. For those that aren't aware, Voc counselors work in various programs across the mental health and addictions program with the goal of helping persons with barriers to employment with their mental health recovery through return to work, return to school, and volunteer initiatives. Here's just a short list of some of the highlights and successes over the last couple of years. They include shifts to virtual care as well as other blended models of care, providing clients with continued access to real work, real learning opportunities, both on-site and in the community, as well as being flexible and supporting our teams by engaging in team care approaches and through redeployment. So congrats again, and thanks to all my colleagues.
The Excellence in Practice Award for Team Innovation is dedicated to a group of health professionals who demonstrate an ability to develop innovative and adapted practices for clinical service delivery. They introduce and enable new approaches to enhance the quality of patient care and professional practice. This team is progressive, favoring and promoting progress in their profession and within their clinical service. The Interdisciplinary Connect team is centralized, taking in and allocating all outpatient mental health referrals, improving flow and access for outpatients. In addition, during COVID-19, this team, in collaboration with the Anxiety Treatment and Research Clinic, stepped up to become a vital hub for connecting healthcare workers to help they need. The COVID-19 Mental Health Support Team responded to the needs of friends and colleagues to recover from the distressing impact of essential frontline work. This team of experts used an innovative step care model incorporating elements of peer support, psychological first aid, and efficient triage in order to support us all. When COVID restrictions forced us to move to different practices clinically, the Digital Solutions Health Professionals team bridged the gap between clinical practice and information technology in order to ensure effective processes and structures were in place to support staff, physicians, patients, and families. The Vaccine Clinic Pharmacy team has been described as the largest public health mobilization of its type in Canadian history. This team, with its partners, developed, organized, and launched an innovative large-scale COVID vaccination clinic for residents of Hamilton and surrounding area. The Youth Wellness Center team nimbly moved to virtual work and creatively employed Instagram Lives to host their psychoeducation sessions because of the pandemic. Despite COVID, they progressively developed programming to support trans youth and developed programs for Black, Indigenous, and racialized youth. I'm happy to announce we have 2 winners within this category, the first being the Youth Wellness Center team. I would like to ask Fiona Wilson, the Professional Practice Lead for Peer Support, to present this award.
I'm presenting the Team Innovation Award to the Youth Wellness Center Interdisciplinary Team. The Youth Wellness Center team is made up of disciplines including peer support, social work, occupational therapy, nursing, psychiatry, and psychology. 3 innovative approaches in the Youth Wellness Center team's work with youth with mental health and addiction struggles were highlighted in their nomination. The team's COVID pandemic response is one example of how staff have adapted to COVID restrictions in the early days of the pandemic. Despite never conducting virtual care before, within 2 weeks of COVID restrictions, all clinicians pivoted to providing virtual and telephone care so that clients could continue to receive mental health and addiction support. YWC peer support staff leveraged Instagram Live to run art-based programming, host psychoeducation sessions on coping through COVID, and live workouts. During the resurgence of the Black Lives Matter movement due to ongoing police violence in the summer of 2020, staff hosted several well-known personalities and experts for discussions using Instagram Live. Another area of innovation from the YWC team has been the development of services that increase access to trans-affirming care. The YWC team, led by their psychologist, developed a wraparound multidisciplinary program of care that provides trans peer support, access to trans-affirming primary care on-site, expert mental health support, funding for legal name changes, and a pathway to further gender-affirming health care. The team continued this service throughout the pandemic and were able to connect trans youth to the health care they needed during a time when it was extremely hard to access care. The third area of innovation highlighted in this nomination is the YWC's development of services specifically for Black, Indigenous, and racialized youth. Black Table Talk is an innovative new series of weekly youth-led workshops developed by a peer support staff based on feedback from Black youth that explores the nuances of mental health and healing for Black communities through an anti-oppression lens. This project has been covered by the CBC and the Hamilton News and was also highlighted in the January issue of the Ontario Hospital Association News. The Youth Thrive mobile team is a mobile mental health program for racialized youth. The program, co-designed with Black, Indigenous, and racialized youth, and the interdisciplinary team will travel to high schools and local youth centers to provide on-site mental health and addiction support to youth who have barriers to accessing care due to experiences of racial trauma and systemic racism. YWC staff from several disciplines, including peer support, social work, and psychology, are on the steering committee for this first-of-its-kind program, and the new frontline staff are social workers and peer support staff. Every member of the Youth Wellness Center team can be so proud of the innovative, compassionate, and responsive care and services they've created and provided over the last year. It is an honor for me to acknowledge their work and to present this award to one member of the team, peer support staff, Jordana Leman, who is accepting the award on behalf of the whole team at the Youth Wellness Center. Congratulations, Jordana.
Thank you.
There you go.
It's my honor to accept this award on behalf of the Youth Wellness Center team. As Fiona mentioned, we've had to find a lot of innovative new strategies and creative ways to move forward. I'd like to encourage and challenge other teams at St. Joe's to think about ways that you can improve care for marginalized folks who are facing barriers, including trans youth and Black, Indigenous, and racialized people in particular. Thank you so much for this award. We'd be happy to support with that process and share what we've learned along the way, and can't wait to see what we do moving forward.
Also receiving the Team Innovation and Professional Practice Award, the Digital Solutions Health Professional team members, Clinical Application Informatics, Learning and Instructional Design and Analytics. I'd like to ask Andriana Lukic, Director of Digital Solutions, and Dr. Dan Perry, Chief Medical Information Officer and Staff Internist Intensivist, to present this award to the representatives of this team.
It is an absolute honor to be part of the Excellence in Practice Awards. I work as part of a team in the digital solutions world of many professionals who all have gone through great effort to ensure that the last year or so of COVID and usual hospital operations has gone smoothly from a digital perspective. It's amazing to see the work that all of these dedicated health professionals do on a daily basis, above and beyond their usual work days, always available, always helping, ready, and making my life significantly easier as a healthcare provider in the hospital.
At the core of everything that our digital solutions health professionals do is their desire to support exemplary patient care, support excellent patient experiences, and ensure that our providers are equipped with the tools they need to do the best that they can in their work. Over the last year and a half, I've had the pleasure of watching the team be innovative and roll out new workflows for assessment centers, vaccine clinics, updates to COVID-19 order sets, best practice advisories, and documentation in our Dovetail system. They've supported the redeployment of staff by providing virtual training and supported very quick rollout of virtual care and remote monitoring so that patients can receive appropriate care while being safe at home. It is such an honor that I'm able to present the team with the Team Innovation Excellence in Practice Award. And I'd like to say a sincere thank you and express my gratitude to Jen and Jacqueline on behalf of the team.
Thank you so much. We're thrilled to accept this from you too, at the healthcare professionals on our team.
Congratulations.
As this year's event comes to a close, we need to acknowledge all of those of you here present and those who are joining us remotely for having contributed to the success of this event, not only this year, but over the previous years. Thank you to everyone who nominated someone. As you can see reflected on this slide, we have nominees coming to us from a number of different roles, professions across the organization. Thank you to everyone who nominated someone. It takes time to put a nomination together, but doing so allows us to reflect on the importance that this event holds and that each of these individuals who has been nominated holds in our work here at St. Joe's. And we want to thank others, our nomination selection committee, those who took the time to read all of the nominations and score them, to Karen Spring, who provided administrative support to pulling this event together, to our AV team of Christina Macaluso and Adam G, with the recordings that were done and the multitudes of schedules that we changed, to all of our professional practice leaders who submitted discipline-specific appreciation summaries, and to the PAC Health Professionals Excellence in Practice Awards Working Group. These three individuals, Monica Alderson, Sandra Berzeda-Smith, and Susie Maroney, have been there since the beginning, since we started this event 12 years ago. So on behalf of all of us, and for me specifically, Jane Lonke as the chair of the Professional Advisory Committee, our sincere and heartfelt thanks. Please share these thanks with those who weren't able to be here or might not be able to watch, and we look forward to seeing you another year.